Hi everybody, my name is Ollie. I'm a junior doctor living in the Northeast and working in the NHS. Welcome back to my channel. Today is going to be a Q&A. I'm going to try and make it as rapid fire as possible. But today, as I'm recording, it's the Sunday before so-called Black Wednesday, the first Wednesday in August, when all of the new doctors rotate into hospitals all around the country, starting their first jobs as doctors. I'm coming to the end of my first year of practice, so on Wednesday I will start a new job as a Foundation Year 2 doctor, which I'm really excited for, an SHO, but I thought it would be maybe helpful to do one final Q&A before I leave the realms of being an F1 for good and will not be looking back, and I'll just try and get through as many as I can as quickly as possible. First one from Joy Arthur. What is the shadowing like? Does it depend on if the F1 you're shadowing is nice? Great question. It's now standard for all new junior doctors in the UK to shadow an existing Foundation Year 1 doctor in their role for a week before you commence your job as a junior doctor. And you do this in the department that you're due to start in a week's time, such that you obviously get used to how things work on that particular ward. When you start as a brand new doctor, you're not really used to working in hospitals and know how all the systems and everything work. When you start as a new doctor, you won't be up to speed with how things work in the hospital, how to prescribe, how to speak to patients as a doctor and all of this, which you obviously will be more used to for subsequent changes. So that first job as a new doctor is hard. Basically, every F1 that you're shadowing will be nice to you because we've graduated and become F1s recently enough to remember how difficult a transition it is. So the point is that you'll go to the ward, you will do the ward round, you will be shown how to prescribe, be shown how to request any investigations that you might need, specialist bloods, CTs, MRIs, X-rays as inpatient and outpatient, how to refer people to clinics, basically how to do everything that you will need to do as a new doctor. So the answer is that basically we all remember what it was like. We will all be really nice to you and supportive. Don't worry. Dr. Emily Kelly asks, do you regret becoming a doctor? What a thing to answer in this video. The answer is no, not at all, actually. I did medicine as a second degree, as do lots of people. It's actually a more common transition to medicine than we think. Being a doctor is really hard. Being a doctor in the NHS makes that even harder. There are lots of demands on you, not just in work, but outside of work as well, depending on specifically what you want to do. I find it very, very hard to have a life away from work and away from medicine, but your mileage will vary. For me, I love my job. It was 100% the right thing to do for me, but that doesn't make the job any easier. The job is still hard and it will continue to be hard because of what I want to do. I do think we need to encourage people to think very realistically, even from a very early age, about whether medicine is the right thing for them, because increasingly, I don't think it will be the right thing for many people, or rather, lots of people still want to be doctors. I think the number of people for whom that decision is correct is probably getting smaller and smaller year by year. But to reiterate, no, I don't regret becoming a doctor. It's the best job in the world. Michael Nixon asks, do you work all the time? I don't work all the time. I work a lot of the time. So standard for junior doctors is 48 hours a week. And that is an average 48 hours a week. So sometimes you will do more, sometimes you will do less. My average week is probably 44, 45 hours, something like that. But you will have 40-hour weeks, just 9 to 5s. You will have 60-hour weeks. You will have, in some cases, 72-hour weeks, the maximum that you can be rotated for and have it still be legal. It's just the way it goes sometimes. But as I've just alluded to in the previous question, because I want to do surgery in a quite competitive specialty within surgery, that means that basically any waking hour that I'm not spending at work, I am either basically doing this, doing YouTube, or I am doing something to help me get into the specialty that I want. That's not going to be the reality for most people, but for people in my situation, it is. Has the Krebs cycle been used? I know this is something that we meme about a lot, but actually, yes, in some very rare instances. I'm currently doing a clinical pharmacology and toxicology job where everything actually comes down in those patients to the molecular mechanisms and the biochemistry. Then actually, yes, in some very rare instances, it is used, although certainly day to day, not commonly. Bailey Massey wants to know, are we expected to calculate if we've been paid correctly? I mean, basically the answer to that is yes, in that you shouldn't be, and it shouldn't be your job to ensure that you are being paid correctly. But the answer is that mistakes with pay calculations happen a lot for doctors, and your trusts certainly aren't going to go through and comb through everyone's pay slips and make sure that they're correct. So you probably should do, yes. Has medicine affected your love life? That's a good question. No, I suppose, in the sense that I have a medic partner. Aqua, has been on the channel before. Because she's a medic, she's very tolerant of everything that I need to do and how constrained my life is, and she's just starting as an F1, so her life will be constrained in the same way. She also wants to be a surgeon, so she has much the same problems as I do. We make it work. If I didn't have a medic partner, or I was unattached and trying to make it work with a non-medic partner, then I'm sure that things would be different. But for me right now, things are pretty good. I'm very happy. Has your first year changed what you'd like to specialise in further down the line? I think only in the sense that it's helped me cross off some things that I don't want to do. I think thus far this year has been quite good at reinforcing that I don't really want to be a medic, a physician. That is, I either want to be a surgeon or work in something procedural, something like interventional radiology, for example, or potentially something like anaesthetics. Basically what it's told me is my attention span is too short for multiple hours-long ward rounds. I hate them. Would you ever move abroad to practice, e.g. Australia? Maybe. I'm not against it. I'm not against people doing that. I think great, you've got to go where you're valued and you're going to get what you want from life. That's fine. For me, the big challenge with that would be my family. I personally don't have any qualms about going anywhere, but like I said, I've got a family here. I have my partner has her family. Like, we've got things to consider. The CCT and flee mantra isn't going to be an option that works for everyone. If we got into training, or we CCT'd, that is finished training, and we decided, look, hey, the UK, the NHS just isn't working for us, we need to make a decision, especially if you were to have that conversation before having children, for example, or when your children were very young, then maybe. We'll see what the future holds. I don't have any plans to do it right now, but things may change. Don't know. What are the top things we should ask about during shadowing, asks Leah Crabtree. Where handover is, knowing how the ward rounds work, knowing how to request every investigation that you would typically need to order, both as an inpatient and an outpatient, because often those processes are very different. Very genuinely knowing where a good cupboard is to cry in, because sometimes you will need it, and lots of junior doctors need it. Ask how to exception report, how to contact your BMA representative, who the guardian of safe working is, and how to get in touch with your superiors. That is, how to get in touch with the on-call medical and surgical registrars and your consultant, because if things go south, you will need to contact them quickly. So I think having all of those contacts ready and written somewhere, maybe using the induction app, for example, is a really good thing to ask about. Abdullah asks, what do you think of the new medicine apprenticeship route that's been on the news recently? As with every new innovation that comes out of Health Education England and the Department of Health and Social Care, I am very deeply suspicious of this new pathway into medicine. It's sold as being a very positive thing for widening participation. I don't believe for a second that it will be. I think it will have some horrible clause attached to it, like a minimum term of service in the NHS, or restricting people to either underserved areas or underserved specialties, which are not a good thing for people who have to apply through this route. They've not published a lot of the details on how it's going to work, even though it's supposed to start next year, so we'll wait and see. I'll make a full video talking about that soon. Erin Lester asks, does which med school you went to matter after you start work? No, in the UK, all medical degrees are created equally, in the sense that when you go for job applications, it's actually blinded where you went to medical school. So in that sense, a medical degree from Sunderland Medical School is worth the same as a degree from Oxford or Warwick or Leicester or wherever else you like. In terms of your career progression as a doctor, strictly speaking, no. I think practically, in terms of connections, if you ever went private, the prestige of your medical school maybe would make a difference. In the public sector, no. in terms of certain elements of career progression, putting you in touch with the right people, passing your postgraduate exams, things like that, I think that there are links with medical school, but for the most part, no. Does the NHS expect you to work more than employment law states? The answer to this is that basically your employer cannot employ you officially for more hours than the maximum working hours. I think the practical real world answer to this comes in two flavours. One is kind of guilt and clinical need hours, which I'm going to again make a full video talking about. But if it's 10 to 5, you're due to leave at 5 and hand over, and someone arrests on the ward, you have an ethical duty, obviously, to stay and stabilise that patient until the crash team arrives and your services are no longer necessary. But you need to stay until that happens. Equally, same thing, 10 to 5, a family suddenly wants an update and they want to speak to the doctor. If you're the only ward doctor who knows the patients and you're going to be replaced by an on-call doctor who doesn't know anything about those patients, then that maybe is something that you'll feel obligated to stick around for. I know I usually do, and I get stuck in that trap a lot. The other toxic element is that some departments, surgical departments especially, are known for this, is that there is a culture of staying until all the work is done. The problem is that in medicine, the work is never done. There is always something to do, and you may be pressured into not reporting excessive hours, especially because after a certain point the department can either be fined or have other punishments, such as trainees being taken away if their juniors are being treated badly. But you've got to try and push through that, because otherwise things are never going to change. Do you think working as a doctor will change in the next few years? I think we'll get a pay uplift. I genuinely do believe in the pay restoration campaign. I think that there will be some significant output to that. I don't think that working conditions will change anytime soon. I also don't think that the supply of things like training numbers will change anytime soon, or that staffing numbers will change, because all of these things, there's unfortunately no incentive for the NHS to do anything about them because they're a monopsony employer. There's no market force that operates on them. So I think that our pay will get better. I think that being a doctor will probably get worse in the next few years, slowly, insidiously, but I think it will. I can't see any of the big problems in medicine changing anytime soon, as long as we have the government that we do. So there's a two-parter here. At the start of F1, should I be bleeping my reg overnight for small things like a low BP, that is a blood pressure, even if you've seen the patient, fully assessed them and everything is okay? Look, I can't speak on behalf of med regs, right? And I've been the annoying F1, bleeping the F1 overnight. I'm sure I still am, because I don't have that sense of experience, although you get used to quite quickly what you can handle and what you can't. I think the best advice to give when you're starting F1, if you are even slightly worried about anything, you ask for senior help. If you don't want to bother the med reg, you can maybe ask the SHO. The F2 if you're on with one, because they might be able to advise. But I think I could speak on behalf of most medical registrars and even consultants, which is that they will want to know about a sick patient sooner rather than later. And let's say that you only assess the patient as being sick correctly 1 in 4 times. Yes, that's going to be annoying, but at least they know about that sick patient 1 in 4 times, and they've been annoyed about the other 3, rather than not being told at all because the F1 was too overconfident and didn't let them know, and then suddenly they're arresting and they need to be there right now. At the beginning of F1, no one expects you to know what you're doing or to be even like vaguely competent. If you are, then that's a bonus, but very genuinely the standards are on the floor. So just do your best, call for help early, and everything will be fine. Kate G1 asks, when do you actually feel like you know how to do your job? By the end of my first F1 job. So that's 3 to 4 months in. That's when I felt I kind of knew what I was doing in my role as an F1, if that makes sense. Like the rate of cognitive overload had slowed down, because for the first month, 6 weeks, 2 months, like everything is new, everything is scary. Your brain has to be wide open, assimilating new information all the time. By the end of your F1 job, whatever it is, you'll have got used to your role as an F1, at least in that department. Then you'll go on to another job And things will be slightly different, but you'll take those skills forward. You'll already know how to use the IT system, you'll know how to refer, you'll know how to hand over patients, all of that kind of thing. There'll be new things to learn about your new specialty and your new department, but it won't be as overloading as the first time. And then when you move on to your third job of F1, it's exactly the same. The overload will be lower again because you can do more of your skill set confidently. How do I get access to an NHSnet email? They will set you one up when you start as a member of NHS staff. You'll definitely get one during your induction when you start as a doctor because you need one. Do you prefer being an F1 over a med student? Yes, infinitely. Being a med student sucks. Like, it's awful. Being an F1 doctor is rubbish in different ways, but I got very little to no satisfaction out of being a medical student. I get a lot of job satisfaction out of being a doctor, which I think makes the whole thing, relatively speaking, a lot more bearable. Thank you so much for making content free. I'm a first year dental student from Bangladesh. May Allah bless you. Thank you, that's so kind. You're very welcome. Everything will continue to be free on this channel. I have no intention to do anything else. Any advice on how to get an AFP track? This really needs a full video. Academic Foundation Programme, or it's now Specialised Foundation Programme. The answer basically is posters, presentations, prizes, publications as a medical student. That's basically the way everything is regressing at the moment. You have to be clinically very good to pass the interview. You will have your clinical skills tested. The answer is projects. Basically, as a medical student, you have to go above and beyond, try and get experience in a range of things, that is education, leadership and research. Try and do a little bit in all of those domains, ideally with some outputs as discussed, but again, I think we need to talk through that another time. And finally, Angelina Mincha asks, when do junior doctors start working? By the way, I'm not a doctor, I don't even study medicine, I'm just it. Maybe that means interested. The answer, Angelina, is junior doctors start working basically as soon as you finish medical school. So medical school in the UK is between 4 and 6 years long. If you did a degree before medical school like I did, you can do it in 4 years. Most of the time it's 5 years. Some universities specify that it has to be a 6-year course because you take a year out to do an additional degree, which can be in a range of things which they call intercalation. But the answer is that you will finish medical school and then straight away you start working as a junior doctor a couple of months basically after you finish medical school. And that's similar to the internship that's done in most countries after medical school. The junior doctor is basically an intern in terms of what we mean when we use it most of the time. But we have to remember that the term also refers to registrars, that is specialty trainees, so those who are training in a specialty as physicians, as surgeons, as radiologists, whatever, and aren't yet a consultant. Junior doctor is a very, very wide-reaching term that refers to any doctor that isn't a consultant and is in training. So thanks very much for watching, guys. I hope those questions have been answered properly. If you've got any more, leave them in the description and I will answer them as soon as I can. Thanks very much for watching. Take care and I will see you next time. Bye-bye for now.